Hello, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. The quality movement has really taken flight over the past decade or more, but one of the biggest obstacles inhibiting systemic and continued improvements has been the inability for providers to share and learn best practices. In today's healthcare environment where payers, including Medicare, are increasingly tying reimbursement to outcomes, healthcare leaders need to find ways to share information across all care settings. Last December, the Centers for Medicare and Medicaid Services issued $218 million in contracts to support hospital engagement networks, which are aimed at improving the spread of best practices across care settings. By the end of next year, CMS hopes that the so-called HENs will lead to a 40% reduction in hospital-acquired infections and a 20% reduction in readmissions. Beyond the improved outcomes, CMS anticipates that the HEN program could save Medicare $50 billion over 10 years. The American Hospital Association's Health Research and Educational Trust won one of the CMS contracts. HR80's HEN includes 34 state hospital associations and nearly 2,000 hospitals. I'm joined today by HR80 President and AHA Senior Vice President of Research, Maulik Joshi, to talk about the progress he's seen so far. Maulik, thanks for joining me today.
Thank you, Matthew.
So we're about a year into the HEN contract now. Can you tell me a little bit about what you've learned so far? What are some of the lessons you've learned going into this?
What we've learned so far is, first of all, there's a lot of energy around these topics. There's a lot of know-how, and this is an opportunity to share that know-how with each other in doing execution. The second thing we've learned is it's hard work. It's hard work not just on one topic, but when you work on 10 topics together, that's hard work. The third thing we've learned is we do know how, and we have best practices. So this really is about how we can accelerate the adoption of best practices. We're not having to create new things. If somebody wants a great assessment tool, we've got it. Someone in our network has it. If someone wants a new way to work with patients on discharge, we've got so many examples. So when you put that all together, we're learning that you can move fast, and we can show improvement with the data that we're collecting.
So tell me a little bit about how that works. So if a hospital is looking for specific information or they have specific information, how does that percolate up through the HEN? How does it get out through the network?
Our strategy is twofold. First is we're working with our state hospital association partners, and they're doing lots of great activities at the state level. They're doing webinars, they're doing educational events, they're doing collaborative meetings. So at the state level, there's so much great work going on. But we're also complementing that nationally, where HR80 is putting on national activities so that hospitals not only can learn in Louisiana, learn in Florida, but they can come and learn from hospitals all throughout the country. And now we've divided that up as well. We are doing collaboratives on specific topics. So if you want to learn about how do you reduce adverse drug events, we have a collaborative on that. How do you reduce surgical site infections? We have a collaborative. Best experts as well as peers doing this work. The other really, I think, just such an exciting part is we have created Improvement Leader Fellows. So we have now had 900 individuals from hospitals across the country come together in 4 different cities, and they've met 3 times over 6 months, and each time is about a couple of days. And during those 2 days, with their peers, they're learning about the science of improvement. They're learning about how do you manage improvement projects, how do you collect data, how do you engage clinicians in this effort, how do you do teamwork training. They're getting 6 full days over 6 months of improvement, and in between they're getting coaching calls. So we're creating a cadre of improvement leader fellows throughout the country who can keep working on these efforts and keep doing it for the years to come.
So I want to ask you a little bit about that broad CMS goal that they have of a 20% drop in readmissions and 40% in hospital-acquired infections over the 2 years of HEN. How realistic is that?
Well, this is the great part. You have to set bold aims, and we've done that as a country. Now, it's absolutely realistic because we've seen hospitals do this throughout the country. Doing it at a larger scale, has it been done before? No. But can it be done? Absolutely. How can we learn from each other so we can take what's happening in one hospital in California and one hospital in Colorado, where they've done great in falls, they've done great in pressure ulcers, they've done great in collapses, and when you put it all together. So it's absolutely doable. It's daunting, but it's doable. And you have to set that goal to all get towards.
the HEN project is not the only initiative that looks at trying to spread best practices. We've got Joint Commission doing some things, IHI's done some things, even hospitals have come together on their own. So Mayo, Cleveland Clinic, Intermountain, and even HR80 through the CUSP program. What makes HEN different, and what should hospital CEOs be looking at as they see this breadth of programs going on?
That is the big question, and a great question. So I would say one thing, it's not different. It's because it's aligning work that we are doing. We're trying to leverage work that's already happening. So absolutely, our hospitals working on CUSP, which is great. So how do we use that, not only sustain it, but spread that so that you're doing that throughout your hospital and you're doing it throughout the state? The second part, it is different in that we are approaching this as a whole portfolio of work. I think we've been fortunate to have great work like CUSP, working on central line infections, working on urinary tract infections. Now we're saying you're working on 10 together. And I think that's what makes it different. But the foundation is we know how to do it, and we've got programs already working on it. So how do you build upon that? And I think the key is accelerate the work. And that's really the challenge and the opportunity that we have.
And 2013 is the sort of final year of the contract, the current contract with CMS. So what are you hoping to see over the next year?
Yeah, it's actually the easiest one, and it's results. I mean, we are driven by results. It's great to have 900 improvement leader fellows and hundreds of people on our calls and meetings, but the proof is in the results. And so what we hope to see is dramatic reduction in harm and readmissions across as many hospitals, all hospitals that we can, and continue and sustain that performance.
On that question of sustainability, though, what happens in 2014, January 1, 2014, when the HENs no longer officially exist unless there's a new letting of contracts? What happens then? How do you sustain this?
Great question about sustaining. I would say, first of all, if we're training and developing improvement leader fellows, we're going to build that sustainability model as a natural outgrowth of the work that we're doing. So if there are 10 new topics that come in 2014, we've got the people equipped to do that in their own hospitals. The second part is we are creating a national infrastructure for improvement, not just HR80, but all the 26 HENs in the country, along with our partners, QIOs and others. So we're just adding to the national model of organizations that can execute on improvement. So in essence, it should sustain on itself with all the work that we're doing and align with the work that's happening, whether it's pay for performance or value-based purchasing. The nice part is we're all trying to go in the same area, the same row, and that should really help keep us aligned and keep us focused on the ultimate outcomes of patient results.
Well, great. Maulik, I appreciate your time today.
Thank you, Matthew.
For H&HN Daily, I'm Matthew Weinstock.